All right, let's move on to Chapter 20. We're going to be talking about the lymphatic system and lymphoid organs and tissues. And what do you think of when you think of the lymphatic system? Lymph nodes, fighting disease, okay? This is one of the major places in the body in which disease is fought, and microorganisms, and this is the best battleground for your body. And any type of tissue that is associated with the lymphatic system or marked as lymphatic tissue typically is a good battleground, and that's what that tissue is geared towards, is fighting off organisms and disease-causing agents. So that's what we're talking about today. And the lymphatic system is interconnected with the blood vessels. And typically, once something moves into the lymphatic system, it's trapped. So it kind of lures those agents into it, and then they can't really get out. So that's the way it works, and it's tied to the blood vessels in that fashion. Really? It just worked. Okay. All right, so basically, the lymphatic system is a one-way system, and fluids come into the system that have leaked from the blood, so it's linked to the blood and are produced in the cells. Those are all going back to the blood. And here are the three parts. You've got your lymphatic vessels. That's what the lymph, which is the fluid that circulates through the lymphatic system, goes through these vessels. The lymph is the fluid. And then you have lymph nodes all throughout this lymphatic system, and there's little filtering mechanisms or organs. We'll look at the structure of these little lymph nodes in a moment. If you look at the picture here, you can see the structural relationship of the lymphatic system to your blood vessels. So they're linked together, and basically things that leak out the blood vessels can be sucked into the lymphatic system. And we'll go into the structure of that momentarily. So you see how this picture here shows you really easily those lymphatic vessels kind of anamose into the capillaries, so they're really, really linked together. So it's very easy for things to leak into them. So they kind of draw anything that comes out into them. And this lymphatic system is linked to the lymphoid organs and tissues. Sometimes you'll have an organ that has lymph tissue, like associated with it. I'll give you an example. In your digestive system, you have patches of lymphatic tissue. So you don't think of your digestive viscera or your intestines, per se, as a lymphatic organ. We think of tissue, lymphatic tissue that's associated with that organ, and that's something that will happen very often. And basically this tissue is the battleground. So the lymphatic system, I like to think of it, in my mind, it's clear to me that this is the battleground where basically everything is fought. And in the next chapter, we're really going to discuss the strategy. So this chapter is all about the battleground, and in the next chapter, which is chapter 21, is the strategy about how all that takes place. So we're kind of, in this chapter and next chapter, we're kind of delving into military practices. If you look at this from a military standpoint, and it's a fight, we're basically talking about the big fight here. So chapter 21 is about the fight. So you can think of that you've just joined up for the Air Force, and you're learning about how you're going to fight this battle, and that's the lymphatic system and the immune system. So we're going to talk about the battleground in this chapter. In the battleground, in the lymphatic tissue, there's tons of phagocytic cells. What do you think of when you think of phagocytosis? All right, destroy, but typically the destruction happens in the form of engulfing and eating. Remember, if you'll remember back from your basic biology class, we associate phago with eating and pino with drinking. You remember that, pinocytosis and phagocytosis? So phagocytosis is going to chop something to pieces pretty much, so it's eating it. So lots of phagocytic cells, and basically what happens is Remember when we were talking about blood, and we were talking about antigens and how the body reacts when it comes in contact with a foreign antigen? Well, we're going through that process. Foreign antigen seen. What's going to happen? Well, if it's a phagocytic cell, it goes to it, engulfs it, and eats it to pieces. So that's what we're talking about when we're talking about phagocytic cells. We have phagocytic cells and we have lymphocytes. We've looked at the structure of a lymphocyte, right? So in Chapter 17, we talked about lymphocytes briefly and vaguely. Didn't go into a lot of detail, but we do know that when we go into lymphocytes, we're going to talk about B cells and T cells. And B cells and T cells, and these are types of lymphocytes. They're the two types we majorly discuss. And Chapter 21 is going to go into a lot of detail about B cells and T cells. You're going to know B cells and T cells in a much better light. So right now it's just a lymphocyte, and we've just basically hit the surface, but we're really going to go into detail about those lymphocytes in Chapter 21. And that is our body's defense mechanism. So we're talking about the battlegrounds. The lymphatic vessels are somewhat similar to blood vessels in certain instances, but they are part of the lymphatic system. And when we think of blood, we think of circulation in one direction. But when we think of the lymphatic system, we still have that one direction going on. But it's kind of like once you get in here, it's like the point of no return. It's very difficult to get out. And the reason for that, if you look at this little structure here, look at this picture, and you see the little flaps. So there's these little flaps on the lymphatic system. And they have a little anchoring connective tissue. So it's kind of easy to get in that little flap, but it's kind of hard to get out that little flap. And that's how it's kind of trapping. And so it kind of lures, things kind of flow in relatively easy. So they're lured in, and then they have a hard time getting out. Very similar, but in a different location. So that just, the valves in the heart and the valves in the veins that prevented backflow. But here, the flaps are having the purpose of keeping things from leaving the system. So the permeability is different. So in the blood, we had endothelial tissue that was permeable through. Here, we've got these flaps that making it not as permeable. So the permeability is different. And basically, lymphatic vessels are absent in certain places. We don't have them in bones, teeth, bone marrow, and you don't have lymphatic vessels in the central nervous system. So these particular areas of the body have different ways of dealing with defense. At the central nervous system, for example, talking about the brain, y'all remember last semester we talked about the blood-brain barrier? Y'all remember that? And that was protective of the brain. So there's different mechanisms in place. And these vessels are formed by loosely connected endothelial cells, but they're overlapping. And that overlapping is what forms these little valves that you can get in, but more difficult to get out. You also have lacteals. These are specialized lymphatic capillary beds that are found in the intestinal wall to absorb fats. And they're just a little bit different than the lymphatic vessels, but they actually have a different purpose to collect the fats. All right, so lymphatic vessels, they form capillaries, and you saw how they anastomosed and kind of intertwined in the capillary beds with the blood vessels. But lymphatic vessels have their own little capillaries, and that's what you see intertwined into the capillary beds. Lymph flows through successively larger vessels, and that lymph flows through. Lymphatic vessels have tunics, just like the blood vessels did. And you probably noticed a theme in A and P. Most of the time you have 3 tunics. So those 3 tunics are found in the lymphatic vessels. Now, vessels have trunks. And you'll see, that last picture you saw showed how blood was circulating. It was a circulatory process in the blood vessels. But the lymphatic system is kind of different, and it's not circulating in the same way. Now, it does empty into the heart. Same way blood empties into the heart, but it's it will then pick up more lymph from the blood vessels coming off, and it will actually go into those lymph vessels. You have these trunks, these larger collecting vessels in the lumbar region, the bronchomediastinal region, the subclavian region, the jugular, and the intestinal region. So there's trunks that we can actually denote where the lymphatic vessels all come together and dump into those trunks. And then those trunks actually dump into a much larger vessel called a duct. They're the largest vessels that that drains into the blood, and you have a right lymphatic duct draining your right arm, your right side of your head, and your thorax. You have a thoracic duct that drains the remainder of the body, and they're draining into the subclavian veins, and of course will dump into the heart at that point. Lymph moves due to skeletal muscle contraction. So that your muscle contraction helps to move that lymph and circulate it through the body. So here's what we were looking at. So we were actually talking about how these kind of dump into those trunks and then into the ducts. And this particular picture kind of shows you where that occurs. And you can see the little nodes coming off. Anybody know where you find most of your lymph nodes? What are the largest? Where are they most abundant? Yep. Axillary region, cervical region, and groin region also. So lots of lymph nodes there. And so they're circulating. And here's those brachiocephalic veins. And look here, you can see where the lymphatic system dumps right here. Into the subclavian veins. Everybody see that? So the left and right subclavian vein. So that's where it dumps in. And the heart's right in here. So then that'll dump into the heart. Then you can see, here's the left lumbar trunk. We pointed that out. Here, you can see, trying to see what else I need to point out to you here. Looking at the diagram on the left, you can see those concentrated regions of lymph nodes. So again, cervical region, axillary region, groin region, you can see there's lots of those. Here's the thoracic duct here. You can see that where it dumps in. So those are some of those that we talked about in the last slide. All right. Now let's talk about the lymphoid cells. So lymphocytes, we've already mentioned, yes. Yeah, yeah. Yeah, they're just denoting, they're just calling that's the point at where it's delivering. And the vessels at that point are the largest to the blood supply. But this right here is the only points at which it dumps. So it dumps right before it gets back into the heart. Yeah. Your ducts, well, you have lots of different trunks, and those are smaller than ducts, okay? And the ducts are the largest vessels. And you have basically right thoracic. Actually, yes. So right here is where you're talking. Right here, yes. The lymph. And the process starts over. There are some similarities. The composition's a little bit different. The main difference is, of course, no red blood cells, but some of the white blood cells are here, but we don't have the red blood cells because the white blood cells are our immune system, so we're going to find a bunch of those. And then immune elements. So the lymphatic system, the lymph contains the immune elements. All right, so I told you that the lymphocytes are what or differentiate into T cells or B cells depending on where they originated. And these cells are major responders to antigens. So they respond to foreign antigens. So when something is not flagged in your body as your own, so your body doesn't recognize it, these cells are on high alert. They will begin the process of, that's foreign to our body, we have to get rid of it. Macrophages are those phagocytic cells. We said earlier there's lots of phagocytic cells. Macrophages, that's what they do. Macrophages engulf and eat. We also have cells called reticular cells. Do you remember back to connective tissue? We looked at reticular tissue. What did reticular tissue look like? It's creepy, and I very good. My students remember. And when we looked at that tissue, it looked like trees with real branchy looking, look like Halloween trees. And those trees you're going to see that we saw, the tissue that looked like trees, that's a vantage point. It's a hideout point. So that's why reticular tissue is immune tissue. Anytime you think of reticular tissue, you need to be thinking immunity. And that's the point of that tissue. It provides kind of a hideout for these cells to attack. So they're hiding in that creepy looking tissue. Fibroblasts, remember fibroblasts make the fibers, so they make the reticular fibers. They're found in there, and that's what they do, make it. If you'll remember looking at reticular tissue, we would see the fibers, and we saw little nuclei, and that was the fibroblasts that made those fibers. Lymphoid tissue is basically a site of proliferation for lymphocytes. So that's where these lymphocytes are really proliferating, and pretty much when I think of all of this, like when I think of chapter 21 and in this chapter, I think of Star Wars. Because if you'll remember, anybody in here Star Wars fan? One person, two people, three people. Well, I grew up thinking I was Princess Leia, so I love Star Wars. So you need to go and rent or watch, which I own all 6 of them. Go watch 1, 2, 3, 4, 5, 6, and you'll kind of see my analogy to the immune system, because if you'll remember, there's a point at which one of these guys goes off and he clones himself, and there's all these little bitty clones, and those are the clones, right? Remember the clones? So they go off in the clouds on this faraway star somewhere to make all these clones that end up going to Darth Vader. The clones end up being working for the bad guy. But anyway, here, that's like lymphatic tissue. That's where they're going to multiply and proliferate and get ready for the big fight. That's true. Well, that could actually happen if your body was hijacked by something that used your immune cells to do its job. So that could actually be an analogy. All right, so lymphoid tissue is where these lymphocytes are housed, and they do their thing. And the surveillance point, remember how I told you those creepy-looking branches are a good vantage point to hide out and survey. So this is their hideout, and they're looking for the bad guys. There's 2 types of lymphoid tissue. You either have lymphoid tissue. Remember I said, like in the intestines, you have specific tissue. So every organ has got some type of lymphatic tissue in it. So we don't necessarily call that organ a lymphatic organ. It's just got some lymphatic tissue, which is important to it. And then you'll have lymphoid follicles. They're little solid spherical follicles with tightly packed cells with germinal centers. These are going to be your nodes, your lymph nodes. So we're going to look at those in that structure. So your lymph nodes are your principal lymphoid organs, and those are the ones with the little germinal centers. And there's clusters of these, and you've already pointed out to me, clusters of them in the cervical region, the axillary region, and the groin region. And they're clustered throughout those lymphatic vessels. You find them in other places. That's just where you'll find an abundance of lymph nodes. They filter, they're tiny little filters all throughout the body. So all the lymph filters through these little nodes, and they're full of macrophages. And macrophages are removing things and destroying whatever it is constantly. So if you make it through that filter, you aren't worthy of being attacked. So apparently you were recognized as self, or whatever, good. But this is where the macrophages attack. So there's a big battle going on in the lymph nodes. Also, this would be a point where the immune system could be activated depending on what the situation is. So lymphocytes are all in these little nodes. And remember, lymphocytes, or their B cells or T cells, they're looking for foreign antigens. So depending on what they find, they might start out in an all alert, right? So if they find or come across something that is foreign, and they're going to basically be the ones to determine what it is by taking that antigen and flagging the right constituents for that antigen. And so depending on what the antigen is will determine the response. So that antigen means everything. If your body's never seen it before, the fight is not going to be as good. Your body puts on a really good fight on things that it's been exposed to. So you usually, like once you've been exposed to a virus, typically your body knows that virus once it beats it, right? It beats the virus, it fights it, beats it, and it's like, I know this antigen. So the next time that antigen is it's exposed, your body's exposed to that antigen, you knock it out much faster. We'll talk about that in chapter 21 also. So the lymph nodes are super important, right? Those lymph nodes, you need to have them for two reasons. Those macrophages are eating everything in sight. They're voracious. So they'll eat everything up, and then you've got lymphocytes that are hiding out here looking for bad guys, pretty much, foreign antigens. And this is the basic structure of a lymph node. It kind of looks like a bean. Have you noticed that bean shape is, and the bean shape is kind of universal throughout the body, and I was going to mention the kidney. But this does work different from the kidney. The kidney doesn't have these afferent lymphatic vessels here. Basically, the kidney has things come in and leave at the same area of the kidney. In this particular situation, you got all these avenues coming in, but you don't have as many avenues leaving. Do y'all see that? Remember afferent and efferent? Afferent is coming in, right? Efferent is leaving. So you've got all these different avenues for the lymph to come into the node. Why do you think that's the case? Why are there so many more avenues coming in than there are leaving? So basically that means that everything's going to be routed to the same place. So everything's going to be scanned, right? So you might can come in lots of different places, but you're only going to have one place to leave. So that guarantees that everything that comes in is going to make it to the germinal center, where it's going to basically go into the germinal center, and it's going to be scanned by these cells. Everybody sees that. So there's nothing going to go missed here. These basically where things come in, and it's what you can see that there's different coloration in the nodes. Those are showing you the little cells. The center, that's the germinal center. These are lymphatic cells. This is lymphoid tissue here, okay? Here, this is the medulla. You remember how we took the well, we haven't seen the kidney yet, but we will. But usually, most organs will have a medulla in the center and an outer cortex. The adrenal glands will have this. The kidneys have this. We'll talk about, typically, that's how we'll look at a lot of different organs. So the medulla is the inside, and the outside is the cortex. And in the medulla, we have these little structures called the medullary cords. And then where they're not is the sinuses. So everything's going through these sinuses, and it's going to leave. If it passes, it's going to leave through the efferent lymphatic vessels. If it doesn't get eaten by a macrophage, it's going to leave there. So everything comes in the afferent lymphatic vessels, which there are multiple ones, and it's going to leave through the efferent lymphatic vessels. Another common theme is surrounded by a capsule. You see how the lymph node is surrounded by a capsule? We say that very often. The kidneys will have a capsule also. All right, other lymphoid organs of interest. You've got the spleen. All right, and it's located typically on the left side, and it curves around the left side of the stomach. The spleen has a couple of different goals or purposes in our body. And one of the things, the lymphatic part of the spleen provides a site for lymphocyte proliferation. And that's also a place for immune surveillance and response. So the spleen is a major lymphatic organ. And you'll look at, I think we have a picture of the spleen either in your text, maybe in these notes. We don't have it in these notes. But if you turn in your actual text, look at the picture of the spleen. What page is that? On page 757. Do you see where there's red tissue and white tissue in the spleen? All right, so the white tissue is the lymphatic tissue, okay? The white tissue is the part that serves the lymphatic function. The red tissue that you see is the tissue that's responsible for filtering red blood cells. Red blood cells go through the spleen, and the worn out red blood cells are removed here. The spleen is responsible for removing those. It's also a storage reservoir for extra blood, so you store a little extra blood in the spleen, but it's basically becoming engorged so that old worn red blood cells can be removed and broken down. If you remember, the hemoglobin is removed and the iron is sequestered, and then the actual components of the red blood cells, some of them will go to bilirubin, and some of that will go into bile. Some of it will go to feces, so that basically why is poop brown? Because portions of red blood cells are going, and it's being converted and broken down, and that's a waste product. That's the whole. That's pretty funny. Yep, your blood. Very interesting. Yeah, they're not as my whole entire thesis when I was a master's student, I'm a biochemist, was all about urine, and it was testing cancer patient urine to see if treatment was working. You can actually look at certain molecules called polyamines. So not only did I collect urine from cancer patients, but all the grad students had to get, you have to have normal patients as well, and we hope they were normal. There's no telling what was actually in the urine, but I collected everybody's urine. If you could produce urine and you were on my floor, you gave some urine for that. So interesting enough. But the spleen does have that dual function. It does have the lymphatic function. It's a little bit of a storage reservoir for blood, and that's where old, worn-out red blood cells are removed. And those red blood cells are broken down, and yes, that is what some of those worn-out parts, molecules, go into to make your poop brown. I haven't read that. I'm not 100% sure. You can survive once the spleen has been removed. So typically, I do know, like, for example, when your gallbladder is taken out, your gallbladder is responsible for making bile, which allows you to digest fats. So the fats are emulsified, and you're able to, because of the bile, and you're able to break them, put them in your body as needed. And so there's actually a part of the colon that starts making up for this. The liver makes the bile. The gallbladder just simply stores it. So if you have your gallbladder removed, typically you can't eat fatty foods because it's not stored on demand, but parts of your intestines will actually make up for that, and it gets better. But your body compensates. But I'm not 100% sure. I'm guessing maybe you're right. Maybe the liver, being the filtering organ that it is, does pick up when you don't have the spleen. The thymus is also known as a major lymphatic organ, but your thymus atrophies as you age. Your thymus is the most active as an adolescent, and actually when you get in your 20s, it will start to atrophy after you get into your 20s. And this is where T cells go to mature, your thymus. And that's why they're named T cells. The T stands for thymus. And B cells are known as B cells because of the bone marrow. They originate in the bone marrow. Another type of, this is not really an organ, malt. Malt is mucosal-associated lymphoid tissues. These are collections of lymphoid tissues around mucous membranes. So typically where you find, you'll find malt in different places around where you have mucous membranes. I'll give you an example. Peyer's patches. The Peyer's patches are found in your intestines, and they're little aggregated sections of lymphoid tissue that are found in your small intestines. The appendix is not considered malt, but it's a little piece of lymphatic tissue that very often the appendix, anybody ever had to have their appendix removed, had an appendectomy, typically stuff will get trapped in there and get infected. And that's what happens to cause appendicitis. Somehow that gets trapped and can't do its thing, and that lymphatic tissue becomes inflamed. So that's a very common thing. And you have to be careful with that, because if that little appendix structure bursts, you can become septic, because you don't want all that in your stomach. Appendix can be severe, can be a serious issue and cause major problems. So that's something that has to be taken care of. It can, because because you go septic. All that's in your internal viscera, and that's not good at all. So it can be very dangerous. The other organs we have not discussed that are also of importance are your tonsils. Anybody in here had their tonsils removed? Nowadays, they're not that quick to remove tonsils. So used to, they didn't recognize how important of a function they are, but they are, basically when you breathe or chew something up, that's kind of the first lymphatic tissue that has come in contact, right? So those are lymphatic tissue. The reason people have issues with it is because tonsil tissue has crypts in it. And those crypts, and some people are really deep, and stuff gets trapped in those crypts, and it will cause infection. And so people, very often when little kids have lots of infections, they'll just go ahead and take the tonsils out. And sometimes it's absolutely necessary, but used to, you got a couple of infections, and they were just like, we're going to take the tonsils out. They don't do that as much anymore. I still have mine, but I think my husband doesn't have his any longer. So it really just depends. But the tonsils are still important organs, but they can cause you problems. And that's probably true, because those are important lymphatic tissue. Yes, Patricia? That causes a problem too. Yes. They will probably take his out. Because of that, he will breathe so much better. But yeah, you can have enlarged tonsils. I believe the biology teacher, Kristen, has enlarged tonsils. And it causes him to have breathing issues. And I think he's talked about maybe removing his. But if they're enlarged, that's a whole other issue to deal with because of breathing issues. But that's also a common problem. Let's see. Okay, so the tonsils are a form of mucosa-associated lymphatic tissue, and I showed you the Peyer's patches, and appendix is also malt. So these are associated with the intestines. The Peyer's patches and the appendix, they're a mucosa-associated lymphatic tissue found in the intestines, and then your tonsils are a form of mucosa-associated lymphatic tissue. And you have the palatine tonsils, the lingual tonsils, the pharyngeal tonsils, which is what you refer to as your adenoids, and your tubal tonsils. And they remove pathogens entering the pharynx in food and air, as I mentioned earlier. And so they're kind of the first that you come in contact with. So they're, kind of important. Did you guys learn those tonsils? Didn't we learn that last semester, where those tonsils were? We've not. I do want you to go ahead and diagram it. So in your textbook, you can see where those tonsils are located. So go ahead and be able to locate those. Know where those tonsils are located. That's kind of important, especially since some of you will at some point have issues with tonsils. And that concludes this chapter. So we'll stop right there.